How much is it? Is it like a little amount, like almost like a teaspoon? Is it like a teaspoon or is it bigger and a larger amount? Like is it little or is it like a lot of phlegm every time it comes out? You understand my question? Okay, that's good, that's good, that's good. Alright, that's good, alright. I'm asking, when you cough up phlegm, how much is it, amount of it? Like is it just a small amount?
Small.
A small, like a size of your fingernail, or is it like a spoon size?
No, small.
A small amount. And you said mostly clear, white color, sometimes grayish. Right. Okay, alright. So here's what I have to suggest. I'm going to give you a course of antibiotics because of, again, a bacteria was there. Of course, I have to follow up with the result of that culture for the fungal culture, to see if it's confirmed and what is there. This is just a preliminary. I'll give you a copy of it. I want to give you also a prescription for a medication, which is for a parasite. It should be available in the pharmacy. It should be covered by your insurance. I want you to take it's basically for 3 days. I want you to take 2 tablets 3 times a day. So every day you need 6 pills. Okay, that's for a specific type that I'm looking for. So 6 pills of it you need to take for 3 days, so a total of 18 pills. I think they come in bottles or packages of 6 pills each. So it would be like 3 days of treatment. And I want to see if it, again, I don't expect immediate, anything change, but if we see some improvement, might be an indication that maybe it did something. Because if there is a live parasite in your body, it can keep going on and on and on and irritate your lungs and cause the problem like that. And again, there are different groups of parasite can do that, and they can present with a problem, chronic lung problem like this. And it's very, very uncommon in people, like in the U.S., it's mostly in people who are immigrants from other countries, including Southern America. We see that occasionally. I mean, it's a very rare condition. Otherwise, people who live here don't have it. But if you're from other countries, or you're in eating type of a certain raw seafood, it can happen. Usually happens with crab and certain type of lobster, or we call it crayfish. But again, that's a clinical guess. I have no confirmation of that except the fact that you have very high eosinophils, you have these lesions or inflammation in your lungs that can be possibly related to this. And as long as you tolerate the treatment, the pill that I'm giving you, that's a good thing to take. There's no harm in doing it. The side effect of medication is not very significant. I mean, some people get a little bit nausea, vomiting, abdominal pain, but nothing. I don't expect a major side effect. But of course, if you have trouble with it, let me know. Okay.
The treatment must be taken together. The 18 pills.
No. 18 pills, not all together.
No. I mean the antibiotics and.
No. Antibiotics. I can. My suggestion is let's finish the antibiotics right now. Okay. And let her recover from her cold right now. Then you can take those pills after she's done with antibiotics. No, I don't want to mix and match many things at the same time. There's no harm.
Yes,
I mean, if there is a parasite infection has been there for a couple of years, I guess, few more days isn't going to make a difference. So let her recover from what she has right now, cold. I give her like 7 days of antibiotics to take for one bacteria that was in the sputum. I want to make sure I treat that. And after she's done, maybe in 10 days or so, I would like her to take those medications only for 3 days. Like as I said, 2 tablets, like every 8 hours almost, and 2 tablets of them every 8 hours. She takes it and for 3 days total.
Okay, great.
I will, let me get you the prescription stuff, and I'll give you a copy of this.
Thank you. One question.
And on your asthma treatment, I'm not touching it right now, but I will also communicate with Dr. Blair. She sent me a note. I will send her a note and say, but I would like you to come back maybe in about 2 months and see how you're doing. Okay?
Okay. Doctor, how about that?
I think that might be a cold sore. I think that's a cold sore. That's like a. Did you have this before or no in the past?
Never.
Whenever you had fever, did you have like those?
A little, maybe.
Yeah, this looks like a cold sore. I mean, this is almost like a people who have.
It's flu.
Well, I mean, I know she got a flu, but when you have fever, we call it cold sore, which is basically a virus which is in her body, gets reactivated, comes out, and it goes away again.
I mean, it's so strong. The flu is so strong for her.
What, is she coughing a lot or runny nose or anything?
Yes.
I mean, again, when did you have the fever?
When?
Yeah.
Saturday.
And is it gone?
Last
23, 24,
So it's been going on
25.
for a few days. And runny nose as well? Yeah.
I
I
was
mean,
asleep.
unfortunately, this is viral and it gets better. The antibiotic that I'm giving you is not for that flu. Usually those are viral and they go away. You just have to give it time. And for the cold sore, I mean, I know there are some, if you go to pharmacy, there are some over-the-counter medication they sell you, but none of them really is going to change much. It goes away on its own, the cold sore.
Can I go to work like this?
It's again, I don't think there's going to be a problem. Typically, unless it's not a contagious thing, the cold sore, like it is a viral disease, but it's not like you're super contagious to other people. And how many days you have had the cold sores?
Yesterday.
Yesterday. I would give it a couple of days before you go to work. When do you have to go to work?
Tomorrow.
Tomorrow. Okay. Do you have enough sick days or you don't?
I have 6 days, but I call 6 days every maybe 2 days this week, but I can't call.
Oh, I mean, because you have cold. I mean, the part that might be contagious is your flu, not necessarily because of these. And you know, many places they don't want, especially if you're dealing with a lot of food and kind of people don't like see you're sneezing and coughing, and that's not even good for them. I mean, so you might want to give them use a couple of more days of your sick days before your runny nose and your fever and everything is gone. But I mean, the viral infection, nothing is going to fix it. Like there's no treatment for it that makes it go away. To me, it sounds like you got a flu, and that should go. I mean, you just got to give it a few more days, and it goes away. The antibiotic I'm giving you is for that one bacteria which was in your lungs. I don't think that's the reason that you're having all this asthma problem. It just happens to be there. I'm going to give it 7 days of treatment to make sure it goes away. But if you want me to write a note for you to go, you can go back to work in 3 days. I can do that. But again, it's because you have flu. That's all. Otherwise, I don't think this is going to contaminate the food or anything.
Or get an infection.
But you can pass your flu to your colleagues. That you can do that. Yeah.
Oh my God.
But this is cold sore. What you have here on your lips and your nose is cold sore, and that's because of your flu. And usually people, when they get it once, they get it again as well.
I got a flu too the day before she took. And my eyes are like
Red.
no red, like ¿cómo se dice cuando se hinchado?
Inflammation.
Inflammation.
Yeah, in her.
I mean, different.
Everybody is a little
depend of the
different.
person.
But
Yeah.
I mean, if you had runny nose and fever and kind of like but usually comes with body ache, headache. It's flu
Then I
season.
have a headache. Maybe I don't know when the fever is coming again.
You can take Tylenol as needed, but that's to me sounds again like a flu. I wouldn't assume this is from what you have in your lungs. These are two separate things.
Oh
You
yeah.
got it, and it should get better.
What about the bacteria or the parasite? Is it contagious?
No.
Oh yeah. Oh.
I have absolutely no. This is not something. Not that to. I mean, first of all, again, I'm emphasizing. I don't have a confirmation of that, and there is no. The blood work that is available should be available is not in the U.S. I even asked for it, but it's not available to order it. They said maybe in NIH somebody can do it for you, but it's not a practical thing for me to order it, and she can go get it. And especially if she tolerates the treatment for 3 days, it's worth to do it rather than chasing some blood work that may or may not be able to do it. Sometimes if the parasite is in the body, it shows up on a like a samples that we get from the lungs, and sometimes it doesn't. Again, doesn't rule it out, but if it's you see it, then it's a confirmation of the disease. I want to give her the treatment because this has been going on for a few years, and because you are from, like me, you're from different country, and depending on your exposure chance to this type of a parasite, it's a possibility that you may have it. And if you, if you tolerate the treatment, there's no harm doing it. Okay. So let me write down this stuff. Do you want me to write a note for you to? You can go back in 3 days to work, or what do you want me
Or
to do?
2 days.
2 days.
2 days.
Maybe.
Today is
Friday.
Wednesday.
Friday.
Do you work on weekends or you don't work on weekends?
Yes.
Okay.
Yeah.
I can write down. You can go back to work on
Sunday.
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 I come back on Sunday.
Okay,
Exactly.
I can do that. Sunday is good.
Thank you.
Alright.
Thank you.
You're welcome. You're welcome.